Good afternoon. Today, we'll discuss about facial and RF. Facial is essentially a multi-step skin treatment that is one of the best way to nourish and pamper your skin. Facial is the second most popular spa treatment after massage. The basic steps of facial. First is consultation of doctor. Then, proceed to cleansing, skin analysis, steam, extraction, facial massage, facial mask, and final application of moisturizer and sunscreen. The medical purposes of having a facial is to improve overall appearance. What are the skin types? First is dry skin. Dry skin is usually feel tight and rough. Causes of having a dry skin is washing too much, peeling on too much product, and water is too hot. Treatment for your dry skin is less use of cleanser, better night skincare routine, stick with products, use moisturizer every day, and 20 minutes of face mask. Next is oily skin. Oily skin has excess oil all over the face. Causes of having oily skin produce more sebum by makeup and climate or pollution. Treatment for having an oily skin is cleanse well, lightweight moisturizer, exfoliate regular, drink a lot, keep your hands off, and 10 to 20 minutes face mask to penetrate your skin. And 3, combination skin. Combination skin type is only in some areas and dry in others. Combination skin type is oily forehead, nose, but dry across your cheeks. Treatment of having a combination skin is use cleanser for combination skin, follow with toner containing with hazel on the oilier parts, use SPF 15, moisturizer containing alpha hydroxy acid, helps to remove dead skin, moisturize at night, use 2 moisturizer, the lighter moisturizer and oil-free moisturizer, 10 to 20 minutes of face mask. And number 4 is sensitive skin. Sensitive skin is often red and irritated. Sensitive skin has 2 types. First is dry sensitives, prone to irritation. Next is oily sensitive, prone to breakouts. Treatment for having a sensitive skin is hydrating facial, oxygen facial, avoid abrasive facial with extraction, no more than 15 minutes of face mask. Then, lastly is normal skin. Normal skin has normal pH balance. When you have a normal skin, all types of facial are allowed. 10 to 15 minutes of face mask. Then, skin condition. Skin condition are acne, blackheads, and aging, sun damage, and dehydrated skin. Acne. Acne is clogged with oil, dead skin, and bacteria. This build-up results in swelling or pimples. Stress is unfortunately very common among adults exposed to dirt and dust. Too much eating of oily and sweet foods. Treatment of acne. Same treatment with facial, but the patient should maintain the cleanliness of her or his face. Aftercare. Use cleanser every morning, toner, moisturizer, and sunscreen. Blackheads. Blackheads is producing too much oil, bacteria on the skin. Causes undergoing hormonal changes, especially during teen years. Treatment. Use a clay mask, charcoal mask, and aftercare of blackheads is Use cleanser every morning and night. Avoid com comedogenic products like argan oil, avocado butter, borage oil, and hemp oil. Aftercare, use cleanser every morning. Ay, nasabi ko na to. And avoid comedogenic. Use oil-free products and SPF screen. Aging. Aging is a process of growing old. Treatment. Vitamin C face mask, anti-aging face mask, and use RF. Aftercare. Use sun protection and lotion. Apply moisturizer every day. Stop smoking. Eat healthy foods. Get enough sleep. Sun damage. The treatment of sun damage are pumpkin and honey face mask and lemon face mask. It will help because of antibacterial property and moisturizes the dry skin, soothing the pain. Aftercare of having sun damage, cool baths, moisturizer, drink extra water, and use SPF. Dehydrated skin, lacking of water, it can be dry and itchy. Treatment of having dehydrated skin, wash the face using the water with lemon, cleanse, steam, moisturize, use dehydrating mask, moisturizing mask. Aftercare of having a dehydrating skin, drink less coffee or sources of caffeine, stop smoking, exercise regularly, and drink water.
Okay. So, dapat you should be applying what you read on our patients.
Yeah.
So, parang when they enter, you have to assess the skin. Like,
Yeah.
what kind of skin? Di ba, what are the 4 kinds of skin you said?
Dry skin, oily skin, combination, sensitive, and normal. 5.
And sensitive.
Si Kevin meron siyang combination skin to. Kasi oily yung forehead niya, tapos medyo dry yung cheeks niya. Pero dito kasi parang meron siyang mga sunburn dito sa may side niya.
Oh.
What about for Sean?
Hindi ko pa nakita. Hindi ko pa
It's
na...
pimply, no?
Hindi ko pa nakita kasi yung face ni Sean.
So, parang
It's
when you
it's-
already
it's
classify the kind of skin they have, then you would know the kind of mask that you're going to apply, di ba? There are specific kinds of mask that you can apply.
Opo. Then, na-research ko rin kanina, Doc, yung RF. Ginamit ko siya kay Kevin kasi tinatanggal din pala yung pimples. Parang pinapatay na din yung mga pimples. Kaya, good na ginamit ko kay Kevin sa cheeks niya kasi meron siyang mga
Acne.
sa may cheeks area niya.
Pero with Sir Jobber Reyes, he looked like he didn't have oily skin. It was actually dry.
Dry skin.
He had dry skin.
And then you would also know the number of minutes na you're just going to leave the mask on,
Mask,
depending
opo.
on the type
Skin
of
type.
the skin. Diba? And then you tell them dapat yung aftercare na, o okay, dapat you should be telling them, okay, of course this is not going to be magic na you're just going to do it once. It has to be done regularly, ma'am. You know, kasi syempre, every day you're exposed to different kinds of stress, di ba? Or di ba, uwi ka, you're commuting, and then dapat may regular ka na skin hygiene, and you should be putting mga sunblock, you know, avoid the sun. Dapat you teach them also, and then you put na these products are better for your kind of skin. Ganun, para they can come back for mga regular facial. Tatanungin ka, and how soon should I get ba another facial? How often should I get it? Diba sabi nga, usually mga every once a month dapat nagpapa-cleaning. Sabi mo sa kanila, recommended po kasi ma'am is once a month po dapat for regular maintenance.
What if they would want to increase the number of facials they get per month? Is that going to affect their skin?
If they have so much money, edi better. Sige, they can
Twice
have
or
it every
thrice
twice a month. But
a month?
then,
Possible?
don't make it na too harsh. Yung mga less na lang yung number of hours of minutes of for the face mask, no more tweaking. So more on parang i-manage. Pero wala namang ganun after twice a month nagpapa-facial, ewan ko. But why you want to have twice a month facial?
No, it's
Have you seen people
for
who have done it?
It's for maintenance at the same time.
Twice a month maintenance?
I feel like kasi personally, after 1 week, my skin becomes back
Yeah,
to
if
its
you want.
original
If you have
state.
so much money naman, hindi mo pa-facial ka na magpa-facial. Pero at least,
Yeah.
twice a week. Yeah. Okay, so I hope you learn something from it and you can apply it to our patients. Diba? Para pagdating pa lang, ay sir, you have, kasi yung dry po yung skin type niyo, dapat it should be like this. So you can give recommendations. Hindi, ay ano ba, ay hindi ko pa alam eh, ay ano, hindi ko wala pa. And yung mga, ano pa, basically, after the facial, you should be giving them mga tips on how to take care of their skin already.
Aftercare.
Yes. So dapat sasabihan mo na yan. Diba? Para magiging parang authoritative. Ikaw yung authority na, ganun ba? Kasi we have patients already na ganyan eh. And this is what we advise them to do. And now, they're doing well. Their skin is so nice. Like, who's that? Renz, his skin daw is so nice already.
Right now,
So he's coming back already. He's
minus
gonna come back and I don't
Yung
know when he's gonna
nag-complain,
reschedule.
Rizaldo, the guy with curly hair.
Yeah. So, but his skin is really getting better. His skin, because he's also taking medications at the same time. Kasi if you have severe acne, you should be putting already mga antibiotics and you should be taking them orally. So nakapag-start na siya ng treatment aside from the facial. So it's getting better. Okay, next.
Our next topic.
Very good si Eliza. What's your next topic?
Research ko, Dok. Talagang ginagulgol ko ng bongga yung Google.
Very good.
Hindi
I
ako
hope you
nakakontento.
learn.
Hindi ako
Yes.
nakakontento sa isang article. Gusto ko mga 10 article, then kukunin ko yung best advice.
That's
Pinagsama-sama
good.
ko lahat.
And you should always get the latest ones. Kasi yan yung mga before it's like this, pero now may mga better. So kukuha ka na ng mga bago. Ito, doktora, ito mas maganda, ganito, ito na yung uso, this is what's coming out now, this is the new one. Maybe we should try this kasi ito na yung bago. Kasi parang, we have to innovate, hindi pala panay luma. Dito tayo, I think it would be better if we'll do this. So you give suggestions. Diba? Dapat ganun. Okay.
RF, also known as radio frequency, is the spectrum of electric waves moving through space at the speed of light. The frequency of an RF signal is usually expressed in terms of a unit called the hertz, Hz. Usage of RF. Non-telecommunication-wise, RF waves heat material being processed in the same way that a microwave oven cooks food. Other uses for medical applications include diathermy and MRI. The technique involving the production of heat in a part of the body by high electric currents to stimulate circulation, to relieve pain, to destroy unhealthy tissue, and to cause bleeding vessels to clot. Number 2, the usage of RF waves in an MRI. An MRI is a type of scan that uses...
MRI? No, not the MRI.
Okay.
We don't
So,
need that. We're not doing MRI
okay, let's
here.
skip that. Effects. The effects of RF
On skin.
on the skin. According to the World Health Organization, all populations are now exposed to the spectrum, and the levels will continue to increase as technology advances. And there's also a warning that tissue damage could occur during exposure to high RF levels. That's why we only make the intensity under like 7, because when it's like past 7 and then you leave the the tip of the RF head on the said part of your body, it feels like it's burning.
Yeah, that's why you have to keep moving it, diba? That's why you don't have to just let it stay there for us on one position, one location for a long period of time because it's very hot. That's why you always have to keep moving it. Yung ganyan, diba? Or up and down. It's constant motion. You just don't leave it there. It's like plancha, the iron. When you leave it there, when you remove it, it's burnt already. Sunog. Or the patient will complain, ouch, ouch, it's burning. So what are the uses of RF? Why do we use it for the skin?
To stimulate blood circulation, to relieve pain, to destroy unhealthy tissue, and to cause bleeding vessels to clot. And the main reason is also to get rid of unwanted fats in the body. That's why, diba, right after they feel like peeing, right after the session, most patients feel like they want to pee.
Why?
That is the fats melting.
Yeah, so there's you have to put it on a certain location, no, like here, going upward. Why? Because the lymph nodes are here. No, so you're letting it go there so that it can drain through the lymph nodes. And here naman, when you're doing RF on the tummy, you want it all to go down here para it's going naman to the urinary bladder. So when you do like that, it's going there, like that, like so. Not going up where will it drain here. The lymph nodes are here, so it will go down here. There's a reason why you do these motions. No? So everything goes to the lymph node because the fat cells they undergo lysis. They explode inside. They become fluid, and then it gets absorbed by the lymph nodes, and then sometimes the patient would feel like peeing. It goes to the pee, to the wee-wee. But of course, it's not again, di ba? Na magic na naman, na after one session, bakit it's still there, parang nothing's happening. Of course, you have to do it regularly, and the recommended is at least 10 sessions na every 2 weeks. If who's gonna do that, it's an expensive procedure. Diba? So, tapos after that, maintenance also. I-maintain mo pa rin after 10 weeks na every 2 weeks, 10 sessions after that. So every 2 weeks, gawin mo na siyang every 3 weeks. Ang maximum is once a month, dapat ina-RF ka.
Yeah.
Na regularly. You get it.
If you aren't consistent with the RF, then the effects of it, like, you may not see the results in a month's time if you aren't consistent with it.
That's why it can also be used for reshaping, no? Like for example, it burns fats here, so it also tightens kasi the muscle. It contracts when you put heat. Syempre, the muscles contract when heat is applied to it. That's why they feel like parang, na-lift. Kasi nag-contract, the muscles contract, so na-lift yung skin niya. See? So that's why we do it for facial reshaping. Here, if you want your double chin to disappear, we can do that. We can remove it using RF. That's why we combine it with mesotherapy and RF. And then RF here, if you want to have a jawline that's very prominent, or yung mga chubby cheeks, if you want it to become thinner, you can do RF. RF to chubby cheeks. Even here, you can do it on the arms, to tighten. Or if it's fat, to make it
applicable
smaller.
for both the face and the body.
Yeah, so and on the body, and then actually some patients we do RF, full body RF, that's 15,000. So you do on the face, here on the neck, and on the arms.
Whole body, including the face.
Yes. Here on the arms, tummy, and then the inner thighs. It's like that. Okay?
Yeah.
Pero make sure na you keep moving it. Kasi kundi masusunog, the patient will complain, ouch, it's so too hot. And make sure that the plate is in contact with the skin before you put the probe. Otherwise, that patient will get burnt also. Okay? You will notice, ba't amoy sunog? Nasusunog na yung buhok. Nasusunog yung buhok din sa skin ng patient. Very delikado. That's electricity electricity yan. Naka-kuryente. So, it's no joke. So when you turn it on, usually mga 5 to 10 minutes the procedure, you just plug it already. Tapos, before using para to warm it up. And then after that, when you're done naman, you let it cool down. Kasi masisira yung machine eh. I bought that before, that's cheap pa. I got that for mga almost 300,000. That machine is expensive. Okay, that's before pa. Ngayon, mas mahal na yan. Pag bibili ka, siguro mga 600, 700,000 na yung isang machine. There are machines that are cheaper, yung mga RF machine, it's really cheap. Like may iba, 150,000, but those are not effective. Okay, that's why you will see in mga salons, RF, 500. RF, kasi the machines are not really effective, so it's just a waste of money actually. And we don't like that because we want to show them results. But then you have to pay for it because the machine really works, because the machine is so expensive. The machine itself is expensive. That's why you have to take good care of it because it's not a cheap machine. And usually sa salon din, kasi ang recommended at least is mga minimum kahit mga 25 to 30 minutes dapat per session. Sa iba kasi gagawin, babawasan, 15 minutes lang. Yan, para they will charge lower. So, merong mga catch. No, sabi, ba't doon, ganun lang. So, pagka may na ganun na nag-comment, ba't doon sa ganun lang doon ng RF, ganun. Ano po ba yung klaseng RF nila po doon? Kasi po, iba-iba po ang klase ng RF. Is it effective po ba? Kasi pagkamura lang po yung RF machine na yun, that's why they can charge you very low, at a low cost. But it's also not going to be effective. Ang machine po namin is really high quality. But if you want to have it down there, it's up to you po. Ganun. We're not naman forcing you. But for us, we can offer you and we can guarantee your results. But then you have to follow also the recommendation, the number of recommended sessions. Dapat ganun. You have to be realistic. You always have to tell patients. Kasi gusto nila minsan magic eh. Walang magic. Diba? You explain that to them. Okay? Okay, very good. O what did you learn naman from your reports?
I learned that with regards to facial, although they have different skin types, there is like one common thing that most of the patients they have this comment about, like with the pricking. Kasi sometimes you don't know if you're putting too much pressure on the.
You will know that as you as you go along, you will learn that, right? Parang yung pressure na nilalagay nyo, alam nyo na.
Yeah.
Because you would know naman if your skin looks
na ko na yung nose, ang dami kong na-prick sa kanya.
Yan mo?
Alam ko na tansyahin yung pressure.
Tsaka makikita mo yung skin pag masyado ng manipis, bubundiinan, magsusugat yan.
He actually has his own extractor now. He bought it from Lazada.
That's good. So pag magsusugat kasi, pag nakita mong skin, well-maintained, maganda yung skin, konti na lang halos ang gagawin mo dyan. Huwag ka lang masyadong magdiin mag-prick, magsusugat, di nag-complain yung patient, bakit ako sinugatan mo ako? Ang diin mo kasi dahan-dahan lang sa kanila, dahan-dahan lang. Unless makikita mo, iba skin nila very thick. Diba? Yun, medyo kailangan. Yung mga lalaki normally thick yung skin, lalo na pag hindi nagpapa-facial dati. Sila rin, yan, mga thick yung skin nila. But, that's the purpose of the steamer. Kaya mo siya ini-steam. Ano ba purpose nun?
To open the pores.
Yes, to open the pores.
Open up the pores, and then the cold compress naman is to close the pores.
Yeah, so you want to open up the pores para it will be easier to extract. Diba? And while it's open also, now you put the mask para ma-absorb yung chemicals na may mga anti-aging or hydrating na lalagay yung mask. Pero may number of minutes, hindi pala pwedeng masyadong matagal. So dapat you know then what kind of mask you're going to apply on depending on the skin type. Diba? So what is your next report? Very good.
Our
Next
next
time,
report,
ano naman, ay hindi
Fillers.
wala.
about fillers.
Fillers.
Fillers and,
Just fillers.
What
Both
Botox.
of us.
yes,
Fillers and
fillers and
And
Botox.
Botox. So,
So fillers and Botox, yung wala na kayo, ano ba ngayon? January 20,
20.
okay. 20, is it 20, 21? 21, okay. So let's see, basta usually when we're not busy, pero maganda sana every, di next week na, Wednesday or Saturday, basta ganun Wednesday or Saturday palagi when we're not busy next week. And then eventually when Stefan is here, Stefan and I will be listening naman to your report. Or when Dr. Diaz is here, Dr. Diaz and me will listen to your report. So it's like us or Conrad, kaya lang he had to go eh. So maybe next time when Conrad naman is here, you can report earlier para he can also give in his mga suggestions. Diba? Okay. Sige.
Thank you,
Thank
Doc.
you.
Thank you.
Okay. Good job.